Hi, everybody. Thanks for joining us today. I'm here with Dr. Andrew Kirschner. He owns a solo practice in Ballackinwood, Pennsylvania. So we're going to ask him some questions today about diet and exercise, some frequently asked questions that patients or people might have in their everyday life. So for starters, what are some common misconceptions you've heard or seen in your own life or in your patients about diet and exercise habits?
Well, there's a couple things to keep in mind. There's always going to be a fad diet, no matter what happens. Whether it's the keto diet or the Cro-Magnon diet or whatever. There's always going to be something out there. Sometimes they're effective for the short term, but none of them represent a long-term diet strategy. Something that I deal with all the time. I'm constantly paying attention to my weight. I come from genetics where everyone in my family deals with weight issues, so I have to work really hard to keep myself at a reasonable weight, and it's not easy. But after all is said and done, when these fad diets burn themselves out and you get tired of them, you're going to go back to your life and eating the way you were eating. But ultimately, the best diet is going to be a well-rounded one that includes different things from each of the different food groups in modest proportions, and accompany that with some regular cardiovascular exercise and some weight training, and you've got a pretty good shot that you'll be healthy.
And for somebody that might be either already struggling or looking to change their diet and exercise habits to be more healthy, what's the best way for them to go about evaluating what they need for their individual health?
Well, I mean, everybody's familiar with the guidelines. The main thing to keep in mind is that the amount of calories you take in versus the amount of calories you burn is going to determine whether or not you're losing weight or not. Some things are easier to burn off than others, but if you don't burn them off, they cause bigger problems. Like, it's really easy to burn off carbohydrates, but if you don't exercise, you're not going to burn them off, and any calories that you don't use get stored. So, if you're looking for an approach and you don't really have a good place to start, your best bet would be at least to have an initial consultation with a nutritionist who can look at what you're eating now and give you recommendations based on what your normal diet is and help you come up with something that will work.
And what would be some consequences of either not doing that if that's a necessary step you need to take, or just not regularly exercising or eating healthy for your individual needs?
Well, the long-term ramifications of not managing your weight are that you have a greater potential for things like heart disease. When you don't remain active, your joints get pretty beat up, and it's sort of like almost counterintuitive. We you think that people who are really active might like ruin their joints, but your joints love to be moving. They love to get lubricated through movement and activity. And one of my mentors, his saying was, "If you rest, you rust." And it's those are words to live by. So stay active. Certainly don't overtrain, but taking a good walk every single day, anything really where you're moving your whole body, getting your heart rate up a little bit, and getting some air through your lungs, it's always going to have a long-term benefit.
And our final question for today is, should people who are either looking to change their habits or just want to get a better feel for whether they are properly dieting, exercising, expect to discuss that with their primary care provider, or is that something they should see a nutritionist for?
A little bit of both, because what will happen is with your routine blood work, you'll get things like cholesterol and triglycerides and get a sense of where your starting point is. You want to have a good ratio of good cholesterol to bad cholesterol. You want your triglycerides to be good. You want your blood sugar to be good. And for managing things like high cholesterol or even early diabetes, you can do a lot through diet and exercise to mitigate those things so they're not as big of a problem. And so you'll get your initial workup from your physician so they can tell you what things you should really be looking out for. And then if you need further guidance, that's when you work with a nutritionist.
Perfect. Well, thank you for answering some frequently asked questions about diet and exercise today. And finally, if somebody's interested in learning more about you or your practice, what's the best way for them to get in contact with you?
You can get in contact with me through our website. The link is on the video. Or you can contact my office manager, Turquoise, at 610-617-9355 or 617-WELL.
Awesome. Thanks so much.
Thank you for having me.
Bye.